I mean, it's very relaxing to sleep on. But it's not relaxing for a patient. For a patient, it's scary dental chair.
Correct.
Dental surgeons or medical as a community is very, very, very resistive towards the embarking of technology into their day-to-day lives.
An app that you could recommend to the public?
Right, ScanO. If you want to smile beautifully, boldly, healthy, and live longer, ScanO app.
Hello everyone, this is Monica, your host for Startup Pods by Ideas to Impact Hub and Binge Pods. This is a startup and entrepreneurship focused podcast where we have 6 segments. Each segment has solid takeaways which you can implement in your business. So the first segment that we have is P&L. So where we would like to know where your revenue comes from and your top expenses that you have.
Right. So most of our, I would say at this point of time, 80% of our revenues come from our B2B, 2C vertical.
Okay.
To name it, it is known as ScanO Air. ScanO Air is the first of its kind, or if I may put, world's first AI screening robot for B2B clienteles. What I mean by our B2B clientele are dental practitioners, multi-specialty hospitals and institute, which pay one-time fees for acquiring ScanO Air, and there is a recurrent software fees for the ScanO OS and ScanO Engage, which is the core AI product of ours.
All right.
So that's where we make 80% of our revenues from. Rest 20% is from the C segment, where once the patient has scanned and has downloaded the patient app, and there are a lot of services that we provide to them, right from teleconsultation to e-prescription to making their 6 monthly checkup on the app itself, so they don't have to go visit a dentist personally until or unless they require some treatment, then they have to come in person.
Oh, great. So interesting.
Yeah.
And what about the expenses?
So with respect to expenses, I would think that any deep AI company or deep tech company would agree that 2 major blocks of expenses. First is the cloud and the compute, and second is the resources, the talent resources. Right. Data engineers and data scientists don't come cheap. Right. And that has been the major buckets for our expenses.
Great. So you mentioned about the cloud where you heavily invest, or that's your expense. So there are cloud partners. So how are you, tying up with them to get those expenses a little on a lesser side?
Correct. So any company first considers either Amazon, Google or Microsoft to have them as a cloud partners. And if we are approaching them in a normal capacity as any startup would, there are limited benefits with respect to the credits which startups get. But we are a part of Class 7 of Google for Startups Accelerator, and also a part of Google Female Founder Academy, which is Asia Pacific. So through them, we have been supported with a lot of credits. If I may put, it's around $500,000 US.
That's a huge
and
number.
Which I'm looking at we can utilize over next 1 year, which saves us the heavy expenses of around 15 lakh rupees a month.
Great. That's a huge number. Number. So you mentioned about Class 7 that you belongs to. So can you explain our audience what is that Class 7 for?
Program? Yeah. So Class 7, which means the 7th batch of Google for Startups Accelerator. It has been 8 years now that Google has launched its accelerator program. So 2024 minus 8, right? That was their first batch. And they were doing one batch of this select startups every year, where around 5,000 startups apply for it. And Google selects around 15 to 20, depending on the batch size that they've selected, to support. And
so you are one of the top 15.
That's right. Both in the Class 7 GFSA and the Google Founder Academy.
Oh, wonderful.
Yeah.
Great.
Yeah.
So that's how you got benefited with that.
That's right.
Okay. You recently visited Japan. Could you just enlighten on that experience? So it was through Google only, or it was some other program that you could?
No, it was a demo day for Asia Pacific. where the audience was all across Japan, Singapore, South Korea, and India.
Okay.
So the entire, it was a week-long program hosted by Google, where we had immersion meetings with VCs, with partners. For example, our main partners are, as I mentioned, dental practitioners and hospitals.
Right.
If we get access through recommendation, closing those clients are much easier.
Correct.
And Japan, especially being a closed ecosystem, right? It's a very resistive market for some different company to come in the country. The vice versa is easier.
Right.
The government in Japan is encouraging their startups to go out and expand in different regions.
Correct.
So if we want to have our product launch, which we did, was supported through Google. And and then through this visit, we could successfully launch ScanO in the Japan ecosystem.
Oh, amazing.
Yeah.
Great. And from where do you get this program details? So is there any portal that our audience could subscribe or have check on these programs regularly if they...
Of course. I mean, first thing, follow my LinkedIn. I keep republishing or resharing a lot of such applications or the details of the programs.
Great.
Second, Google is doing a lot of awareness on LinkedIn. I'm not sure of Facebook. But LinkedIn and Instagram, I've seen a lot of them putting about the program details.
Nice.
And communities, right? Startup communities, like even Eye to Eye, right? Or there are many, if I may put, which keep sharing these opportunities on their WhatsApp groups or wherever that they are connected. So being active in these groups help.
Yes. Yeah. Amazing. So there are patients who are afraid of visiting dentistry or dentist. So, how ScanO Air is different from traditional dentist setup?
To counteract the entire narration of dentistry, right from how a screening is done or diagnostic is done, right? A traditional dental setup, how will a diagnosis happen is you sit in that scary dental chair.
Yes.
I mean, it's very relaxing to sleep on. But it's not relaxing for a patient. For a patient, it's scary dental chair.
Correct.
And then comes the scary dental mouth mirror and probe. Mouth mirror, the small mirror for us to access, looks okayish. But that probe, the one that looks like a pointed thing, the moment it comes near, but no. Like, we are not poking you. We are just,
checking the cavity.
Correct. Moving that probe, which is that needle-like, onto its surface. And that won't hurt you. But that's already ingrained. So we thought, let's take out the entire activity or the ordeal of dental screening outside that scary setup.
Okay.
No clinic.
Okay.
Imagine no clinic, no chair, no instruments, no drilling, no sound of a patient crying from the inside because he's been drilled. Because many time patients in the waiting area are scared of the sounds. 2, now imagine a beautiful setup, which means a relaxing setup, either a mall, or your comfortable place, which is your office, right? Or your society, your home is a very relaxing thing for you.
Correct.
And screening happening there with new age technology. Now through ScanO Air, first this mindset shift has happened. From there to a relaxing environment.
Correct.
You're already at peace. So patient walks in there and it stands in front of this air. And air is like 6 feet long machine.
All right.
Looks beautiful.
Okay.
Looks new age. So it's already generating curiosity. How will this machine give a screening report what that scary dental setup is giving? And then just a few clicks here and there, it's entirely automated.
Okay.
So there are 3 layers of AI in ScanO Air. First is to detect the mouth. So patient just stands in front of the machine and the camera will automatically understand your mouth and stop right in front of it.
Okay.
Just like the digital boarding passes, right? At Digi
Yatra.
But 10x advanced than that.
Okay.
Stops in front of your mouth and then it will kindly tell you that just do E, A, right?
Okay.
Without moving a lot.
All right.
Because camera moves. So that's the second layer of AI where it detects your jaw and then your front angle, upper angle and lower angle beautifully.
Okay.
And third layer of AI will capture all the teeth and capture all the diseases. And a beautiful color-coded bounding boxes will appear.
Okay.
That, hey, you have, first of all, it will show that you have 32, 28, 26 number of teeth. Patients don't even know that, right?
Okay.
How many teeth they have. And then out of, say, 30 teeth that you have, because 2 are extracted, third molars, 12 teeth are diseased. And out of these 12 teeth, there are cavities on 4, 2 are fracture, 1 is missing, 1 is malaligned, and so on and so forth.
Okay.
So there are 36 diseases on tooth alone.
All right.
What ScanO Air can detect through ScanO technology, and then wonderfully show the details of the doctors where you can get your further consultation done or treatment booked.
Amazing.
Yeah.
So where have you installed this ScanO Air?
Right.
So far?
Yeah, there are in total more than 200 across the country.
Okay.
Most of them are placed in South India.
Okay.
In Tamil Nadu, Karnataka, Kerala. We also have in Manipur.
Okay.
So when we had these riots happening, right, one of the doctors had taken it to do free dental checkup camps for the people, for the refugees. Around 4,500 had lost their homes.
All right.
So it placed it in the refugee tents and camps.
Okay.
A few in the West and North India are placing this in malls. Right? Many of them are doing camps in schools and corporate offices.
All right.
Yeah, we've done camps in HCL, Bosch, Google. We are looking at other large corporates as well, where it could be just laying there, not intruding. Whoever wants to come, get a scan done in his or her own privacy, right? And get done with.
So the next segment that we have is opportunities for your business. So we want to know what are the opportunities within the business in your industry, and what are the company's current hiring requirement that you could have.
Perfect. Opportunities are endless.
Yes.
Till date, there was a lot of progression with respect to physical infrastructure, but ScanO is embarking on the opportunity of creating a complete digital infrastructure, where both the provider, which is a doctor, can provide a customized or a personalized service to patients, which are the users, and vice versa. I mean, users with less than half the cost and 10x the speed can get a better health delivered to them, which was not seen before.
Awesome.
Yeah. For hiring, coming back to that, we are looking at dental surgeons who have upskilled themselves with respect to the use of AI in healthcare. Second, to sell a AI product to a dental surgeon, what I, in my experience, have seen is MBAs are not enough. It's a right combination of MBA as well as a dental surgeon. Because only a dental surgeon can technically explain the product, what has been built.
Right.
So dental surgeons who are also upskilled in sales and marketing, right? This is one segment. Second segment, we are looking for data engineers, right, who can add more value to the existing models that we've built.
All right.
And the third segment is, of course, anybody who's curious, very creative with respect to placing and marketing these products. Because there's no area where we can learn from somebody else's experience, because it's the first of its kind product.
Correct.
So, you don't know how to position it. It's a trial and error, and also talking to our existing clients of what made them choose that, and have strategies around the same.
Right. Great. Interesting. So all the folks, or all the young dentists that who are exploring and trying to do something cosmetology also, and MBA in family business or MBA in health management could be the right audience for this type of role, I guess. So the next segment that we have is your important business ka kissa that you had in your journey.
Important business ka kissa.
Yes.
I mean, it has been a roller coaster right from the beginning. Because dental surgeons or medical as a community is very, very, very resistive towards the embarking of technology into their day-to-day lives. Right? Even for thermometer, it took 150 years for medical community to accept it. right? Unko laga if a device is telling the temperature, it's taking away the job of a doctor to tell fever hai ki nahi hai. It is so crazy. Right, and same kind of resistance and mentality was seen when we had launched the product. But again, thanks to many factors, especially the wave of AI, the COVID was blessing in disguise, where it showed everybody that health could be delivered through digital medium as well. Has been learning.
Correct.
So.
But because it was scary during COVID to visit dentists.
Yes, and the dentist's offices were the first one to shut down because that's a direct contamination of saliva and blood at such a close distance.
Right.
And we had no idea how are we going to serve such patients.
Right.
And if you recall, during second wave of COVID, we had highest prevalence of mucormycosis.
Yes. So how did you function that time? Means it was because dentist himself, the dentist job starts once the patient opens their mouth.
Correct.
And the saliva and everything was in line, or means it was scary to, spit somewhere. Somebody spit somewhere during the COVID was alarming.
Yes.
And you people, I mean, the dentist community could deal that saliva when they are operating the patient was little scary. So how did you manage?
Yeah. So again, upskilling the practicing dental surgeons on, there were so many CD programs that how can you have the golden sterilization protocols for treatments which require urgent intervention.
Okay.
Because clinics were shut, but we can't say if there's a pregnant lady, right, or a person with some already existing medical issues. We had to address those things, or mucormycosis, as I mentioned, urgently. So the right use of PPE kits, the sterilization was done at least 20 times in a day. And that was a lot of load, not just on the practitioners, but the assisting staff.
Correct.
But these programs which were done on Zoom, the CDE programs, which are continuing dental education programs, helped. And second, for medical practitioners, we were allowed to go out, right? So in our office, there was nobody but ScanO team, right? Okay. So with the right distances, we also showed them practically a few things which could be used during the treatment in the clinic, as well as a few things could be taken care online. For example, consultation, your initial inspection, giving the diagnostic plan, preparing a treatment plan. That all was done from dentist to a patient online. So that much of contact was at least saved. Yeah.
Right. So the next segment that we have is sales pitch. So I would like to, help the other fellow startup founders understand how a successful founder like you could pitch yourself in 3 minutes. I heard that you had an amazing pitch at Japan Demo Day.
Right.
So please help us understand that.
One day, Kia walked into my dental office with a lot of teeth pain and gums bleeding. On inspection, it was diagnosed that she was suffering from periodontitis, which is an advanced stage of gum disease. Later tests also revealed that she had her heart artery thickening up, which is exactly why we should be looking oral cavity as a whole holistic part of body and not in silos. Hi, I am Dr. Vidhi, dental surgeon, co-founder of ScanO, and today we'll be talking about why have we introduced the product ScanO. Now, Kia can get access to her oral health report just in 10 seconds with one phone, 3 photos, and all she needs is to spend that 10 seconds in clicking those photographs. What else she can get in that is a complete oral health report along with her oral health score of how is the oral health eventually affecting other organs. Kia is not alone. Globally, 3.5 billion people are suffering from teeth disease and gum disorders. And most of them are not even aware of their condition. The ones who are either lack time or access for timely dental checkups. Through ScanO app and Air, now patients can have multiple touch points through which they can have the access to their oral care on their fingertips. It's like having a dentist in your pocket, except it's 10 times faster at 1/10 the cost. We have also launched ScanO Air. ScanO Air is light, it's portable, and the world's first device for public health screening. Now, ScanO Air is being utilized by a lot of dental practitioners, hospitals, and institutes to give access to oral care to 3.5 billion kias across the world so that they can get their smiles back. With respect to traction, I feel proud to mention that we have already installed more than 200 ScanO Air across India and 4 internationally. So far, we have served more than 500,000 users across the globe, and we are increasing 25% month on month with respect to app and air. Come, join us in making this impact, not just as partners, but also as users who can have the access to this technology and eventually oral health in your fingertips so that it eventually reduces the burden of oral health disease globally, and we can become an actual bright, smiling, and a healthy world. Thank you.
Great. Amazing. It was very, very crisp and very up to the point. Amazing. Great. So when you said that oral health is like on your fingertips, means you can take care of your oral health through your fingertips. So generally what I have experienced, so unless and until I personally visit dentist, I'm not able to get it done. So how ScanO is helping patients to get that done?
Typical behavior of patients like Kia, right, our character, is they would only come to a dental surgeon when they are experiencing severe pain, like her again. Or the gums are bleeding all the time, they are not able to sleep, and it is really impacting their daily routine. This point, when the patients come to us, the tooth or the gum have already been destructed beyond 80%.
Okay.
And at this point, beyond 80% is a stage where it is irreversible. We can't reverse the condition, and there are very, very limited treatment options, which do not exactly have a great prognosis for the patient. But if you can understand that you have a stage 1 cavity, which at stage 1 could be reversed.
Right.
It's known as incipient cavity, where it's just the start of demineralization of your enamel.
Okay.
And we can actually reverse it back. And you won't believe that initial cavity does not look black. It looks chalky white. Yeah. And that could be identified and we can reverse back.
Okay.
Even if you have missed scanning or understanding that you have stage 1 cavity, and you catch hold of that cavity in stage 2, where in technical terms we call it as a pit and fissure cavity.
Okay.
There's a small pit, like a dot, like a bindi. Dot on the tooth, which looks a little bit brownish.
Okay.
Even here, we can do an early filling, reducing the total tooth cutting and maintaining the strength at a certain parameter, and can prevent root canal treatment.
Right.
Understand, okay, you've missed the stage 2 also. You've acted lazy, you're not scanned, you've not visited doctor, and now the cavity is in stage 3. Stage 3 cavity is a deep cavity where it has touched your nerves of the tooth, the blood system. And you've heard of the term root canal treatment, right? At this, we can't do a filling. And I feel sorry when I can't do a filling. I was like, you could have saved that tooth with a filling. Now you'll have to get a root canal treatment done. And root canal treatment means taking out the blood, the nerves of the tooth, and filling it up with a biocompatible material.
Right.
Which is not exactly natural. Even this is fine. I was like, stage 3 pe bhi pakad ke get an RCT. But no. After the nerves are damaged, there is no pain because the tooth is dead.
Yes.
You'll get more pain between this stage 2 and 3. Nerves are dead. Tooth is just laying there dead in your mouth and there is no pain. But someday you will come and show it looks so bad. Patient will come because it looks so bad. Itna bada kala daat pada hai. The only option that we have is stage 4, which is grossly decayed, and we have to extract that tooth. A tooth extracted is it's as good as extracting your arm.
Right.
Just because you have 32, ek gaya, do gaya chalta hai. Out of 2 arm, ek gaya to nahi chalega na.
Correct.
So we have to, at stage 4, extract the tooth,
and
put an implant. And again here, many patients are resisting because, implants are expensive. So they would opt for a bridge.
Okay.
In bridge, we do a cutting of a tooth aage and a tooth piche, adjacent tooth, and then fill up the middle area where the tooth has been lost.
Oh.
The problem what happens is, when we place a bridge, there is a bone underlying a tooth, right?
Right.
Which catch holds of the tooth. When the tooth is extracted, the bone is just laying there, have no work. And there's a saying for our bodies that you use it or you lose it, right? So now the bone is not been used for its work. And since it's not been used, we lose it. So it will dire start going down.
Okay.
Okay, imagine the lower teeth.
Yeah.
And when the bone goes down, we call it as the recession of bone and recession of gum. And this is exactly when we tell our patients that please don't go for a bridge. Why? It will only serve for a limited time, and you are harming the adjacent tooth unnecessarily.
Right.
So then go for an implant. An implant which is screwed in the bone, and then we place a cap over it. It costs a lot, right? It costs starting from 25,000 to 50,000, 60,000 a tooth. And this is exactly when, Monica, people say that dentistry is expensive. 60,000 ka ek daat pada. Arey, if you had done a filling for 500 rupees when you were at stage 1, ये 60,000 का खर्चे का जरूरत ही नहीं पड़ता at stage 4.
Correct.
Right. So exactly the problem we are trying to solve is to give access to stage 1. And everybody can take preventive treatments with a preventive mindset.
Great.
Yeah.
And how much does it cost me on ScanO?
To scan?
Yeah.
500 is the filling, right? I mean, this filling is like a sealant. No, I'm telling you. That's where I'm coming. The sealant is 500 rupees.
Okay.
The most preventive treatment, it's 1/10 of that.
Oh, is it?
50 rupees. That's all.
Amazing. Yeah. So, because the patients who are using your app, is that are they recommended by the doctors, or
it's a mix.
Okay.
So the one who have first landed at a dental surgeon, then is recommended. The dental surgeon is recommending a patient that okay, good, we got this treatment done, but to prevent any other further damage, use ScanO app and keep scanning regularly.
Okay.
If there's anything, the patient gets consultation from that doctor.
Okay.
Right?
Okay.
And e-prescription and all of that.
Okay.
So that flow is 65% of our user acquisition.
Okay.
And the pending is through directly
reaching out to the customer.
Yeah, through our website and socials.
Okay.
Yeah.
So am I able to book the appointment to the dentist also through the app?
Yes.
Okay. So how do you see the competition of Practo and ScanO then? So do you feel Practo is a competition to you?
Not really.
Okay.
Because Practo is a listing platform. It's an aggregator of all the dental surgeons and all the other medical professionals around.
Correct. For booking appointment?
For a booking appointment, that's all right. Our model is first and foremost, ScanO Air partners are our core partners.
Okay.
So we would only recommend them to our users.
All right.
And we don't make money when the user or the patient is booking appointment. That's no business model for us. Right. That's where there's no competition. Right.
Correct.
Our competition would be an AI company, right, who's trying to build such models, and doctors adopting those models. Yeah.
So do you have any competition right now?
There are a few players who are emerging, but they are at the initial stage of data collection and labeling.
Right.
Globally, yes, there are 2 players who are doing wonderful job, I may say.
So how are you coping with the competitors?
Well, the pricing, pricing is super competitive because what a doctor can pay in those markets is very different than dentists in India. Right? Second is understanding of the market, the geography and the acceptance of something. Right. Here, getting a patient to a clinic is difficult because of awareness problem.
Right.
Their patients are aware. Especially in the Western market, they are aware of their situation. They want to book an appointment, but doctors are not free. It takes around 3 to 6 months just to see a dentist.
Correct.
Yeah. So the problem statements are very different in both the markets.
Okay, got it. So we'll jump to the next segment that we have is crystal ball. So here, what is the future of your business you could see? So would like to know the top opportunity and top threat if you could narrate us.
Right. Yeah. Crystal ball. So the top opportunity of the business, right? ScanO, if I may visualize 5 years from today or 10 years from today, clearly scanning on your phone or on air, there are 2 more things that we are launching, will become a norm. Then just being something hi-fi what today is, right? Just like, we check traffic before leaving anywhere, right?
Right.
It's a norm.
Yeah.
Similarly, all the patients will be getting their pre-screening and monitoring through AI technology will become a norm.
Right.
Threats would be, AI, no matter how advanced it gets, it's artificial, right?
Correct.
It's not human intelligence. So somewhere I think there might be a few situations where the human touch of a doctor is missing. Because if so much has been taken over,
right.
that could be one of the things. And second, we need to be very, very responsible, especially of AI in healthcare. We know today AI in media or marketing, how troubles have already been seen, right? With respect to deep fake videos and all.
Correct.
So to avoid, we need high regulations. And if regulatory bodies come up with proper structures, which would not stop the innovation, but regulate, then I think the threat would be under control with respect.
So let's jump to the last segment that we have is a rapid fire. So the first question for you is a course that you could recommend to our audience.
There is this course by Andrew NG on deeplearning.com, I think. It's a general course, and I think not just engineers, but doctors or any other person who wants to be associated with AI can take that. Yeah.
The next question is an app that you could recommend to the public.
Right. ScanO. If you want to smile beautifully, boldly, healthy, and live longer, ScanO app.
Great. A book or a podcast series that you could recommend to our audience?
Oh, yeah. A book I would recommend for our aspiring and fellow entrepreneurs is 0 to 1.
Oh, yes.
By Peter Thiel.
Great. One quality that every startup founder should possess?
Resilience.
Interesting.
Yeah, cockroach strategy. No matter, during the funding winter, right? It was either to innovate, and that's how ScanO Air was born.
Right.
You either innovate and go with the tide, or you die. And we didn't want to die.
Right.
And that's how through resilience, we could be what we are today.
Wow. One mistake that startup founders should not make?
Not acting fast.
Okay.
That's a mistake.
Slow.
Yeah, you should be acting fast. That's the correction of the mistakes. So either act fast, which means hire fast, fire faster, right? I used to think 10 times before hiring, and now I don't. I tell the candidate, we have these rounds, you will be hired, but if you don't perform, you can be fired just within a week and be okay with that, right?
And the last one is the one quality to spot in new hiring.
Quality to spot. Curiosity.
Okay.
If a person is curious about everything, he will also figure out a way to get things done. Unlike the one with no curiosity, will just sit thinking entire day long, okay, how do I need to figure things, and eventually would give up thing.
Yes.
Yeah.
Thank you so much, Vidhi. It was lovely having conversation with you, and thank you for being here today.
Thank you so much. It was wonderful talking. Thank you. Yeah.